Might not feel like it right now, but the seasons will begin to change, and sometimes with that, some people say they can feel it in their joints. Is that really a thing, though? Mercy Health Dr. James Lyions is here this afternoon. We can talk more about joint pain, when to seek help. Okay, Doctor, thank you for being here.
Oh, thank you for having me.
Is that a thing? When it gets cold, you get joint pain?
I certainly have a lot of people tell me that it is a thing. So.
And you're young, you don't know yet.
Yeah, I'm not going to through personal experience, but yeah, I think that for sure if the temperature's colder and a joint has a little bit of arthritis or maybe a problem with it, that you can imagine cold weather would make it feel more stiff, and certainly stiffness can be perceived as discomfort or even pain, and it probably is a reason why a lot of people go down to Florida for the winter. So.
True.
Yeah.
And you know, when you talk about like a car, starting your car when it's cold, if it's cold outside, well, our bodies are like that.
Certainly,
Kind of like
it really is. You got to warm up.
Your car says, and your body says, you really want to do this, huh?
Yeah, that's true. That's true.
Man. What symptoms should people pay attention to that may signal something more serious than everyday aches and pains? We try to be active. I mean, everybody wants to get out of the couch and be active, but like sometimes you may, that kind of a twinge there. What's the best word what to do? Give it time?
Yeah, I think some amount of time is always reasonable. It's hard to put an actual number on it because I think in general, like if it's an ache or a pain, and those things generally will start to improve pretty quickly or respond pretty well to or an over-the-counter medication. And they don't generally stop you from doing things, you know, and it's an ache or a pain, but it really shouldn't be a swollen joint or really cause significant weakness or loss of range of motion, or just continue to be a problem or potentially get worse. So, you know, aches and pains don't stop you from being active. They're just kind of a nuisance, you know. So if things get worse or there's significant problems with your range of motion, strength, function, and those indicate that it could be more of a serious problem.
I know from my days when I was in athletics and more active as a younger adult, I occasionally tweak an ankle, sprain an ankle kind of, and is ice still a thing? Ice, compression, elevation?
Yeah, I mean, certainly they say rest, ice, compression, elevation.
Oh, now it's rice.
Yes, yes. But, you know, actually, and those things are good initially to control some swelling. And then, again, when you get to stiffness and someone's trying to rehab something, sometimes heat can be helpful as well. But initially, when you first injure something, ice is helpful.
A lot of times, too, if you sprain an ankle, you're not sure it's swollen up like a basketball.
Yeah.
You're not sure if you broke a bone in there or it's just a sprain that's going to go away.
It can be very difficult to tell. And to be quite honest, I mean, you can have a very bad sprain. It can be black and blue, swollen. And sometimes, quite honestly, you just need an X-ray if it's really that swollen. But sometimes, if you can put weight through it, you can actually bear weight through it, that's a good indication that there may not be a fracture. But even that's not a sure thing. If it's injured enough and swollen enough, then at some point you probably just need to get an X-ray.
You're an orthopedic surgeon, so you've done joint replacements. How do you know? I guess you should go to the doctor and ask and get checked. But how do you know when you need a joint replacement versus try to rehab the joint, go through some physical therapy, and try to get it better?
Well, for most people, it's a slow onset of kind of pain, getting worse over time. You know, a little ache or a pain, but then it becomes more consistent and doesn't go away. And for some people, it can be more abrupt. But in general, if you're really kind of thinking that this joint's a problem, it's because it's stopping you from being healthy. It's stopping you from being active. Maybe you're thinking about the pain in your knee at dinner time more than you are just the conversation with your family. You're not present. It's fatiguing you because it's stressful to deal with pain. And you're just decreasing your activity level. You're compensating too much and becoming inactive.
What's the most common joint replacement you make?
I mean, I think probably the knee is probably the joint that will give people the most problems, followed by the hip. Yeah.
And from surgery to it seems like they get you up right away, get you moving around, because you better to get moving right away.
Absolutely. We've learned over the years that being immobile is not good, especially after surgery. You want to get things moving, and that actually helps with pain control too. If you immobilize something or not moving, again, it comes back to that stiffness again. It can cause more pain, more discomfort. Yeah.
That's amazing how it works out. So how much, if I give you a call, how long does it take to get an office appointment with you?
I think generally, within a week or two, it's pretty easy to get in, especially if someone can communicate to us. If you're in a significant amount of pain, we make every effort to get you in pretty darn quickly.
There's a phone number right there, 419-442-0222, Orthopedics and Sports Medicine. Dr. James Lyions. Thanks so much for your time.
Oh, thank you for having
Appreciate
me.
it.
Yeah.